Welcome, fellow detectives of medicine. Get ready for a masterclass in solving one of the most urgent cases you will ever face. The game, as they say, is afoot, and our adversary is a swift, silent thief of neurological function.
You heard that right. A crime is committed against the brain with absolutely shocking frequency. Now, this isn't just a disease we're talking about, it's a crime scene. A sudden blockage, a brutal deprivation of blood, an ischemic stroke. And our job? We're the investigators who arrive on the scene, gather the clues, and restore order before the damage becomes irreversible. So here's our case file. We've got 6 critical stages for our investigation. We're going to proceed systematically, from examining the scene of the crime all the way to making sure this culprit can never strike again. Let's get started. Okay, first things first, we have to survey the scene. Ischemia is a brutal siege, a sudden, violent cutoff of the brain's vital blood supply. This is where we begin our search for clues, right in the heart of the territory that's under attack. Now take a look at the stark evidence right in front of us. On the left, that bright white on the DWI scan, that reveals the ischemic core. Tragically, this is the district of the brain that's already fallen. The damage is done. But look to the right. The perfusion scan reveals the penumbra. Think of it like a neighboring part of the city with a flickering power grid. It's stunned, it's silent, but it is not lost yet. This is the tissue at risk. This is the part of the city we can still save. And that, right there, is the crucial point. The ischemic penumbra is the entire reason we're here. It is our prime directive, our one and only focus in the acute setting. Every single action we take, every second we save, is all in service of rescuing this salvageable territory. The clock is ticking, folks. With absolutely no time to waste, our actions as first responders are everything. This is no time for improvisation. It is time for a meticulously executed protocol. Speed and precision, those are our watchwords. And this is our guide, the investigator's protocol, pulled straight from the case file. The moment a stroke is suspected, a whole chain of events is set in motion. The pre-hospital call, the code stroke activation when the patient arrives, that rapid neuro exam, and then immediately whisking them off to the CT scanner. Every single step is designed to eliminate delay and shrink that critical window between arrival and our decision to treat. All right, let's proceed to the forensics lab, the neuroimaging suite. This is where the silent images of the brain are going to speak volumes, providing the rock-solid evidence that will guide our hand. Now our first tool, the non-contrast head CT, is elementary, my dear Watson. Its job isn't really to find the ischemic stroke itself, but to rule out its great mimic, a hemorrhage. It answers one simple but profound question: is there blood? If the answer is no, our investigation for the ischemic culprit proceeds immediately. Then advanced imaging gives us the real lay of the land, the size of the core versus that precious penumbra we're trying to save. You know, ultimately, every scan, every sequence, all of this forensic data, it all boils down to this one single fundamental question: is there a viable rescue mission to be undertaken here? The answer to this question determines whether we stand down or launch an all-out assault. Okay, the evidence is confirmed. We've identified salvageable tissue. It's go time. We have a powerful arsenal at our disposal, designed to disarm the culprit, that offending thrombus that is strangling the brain's blood supply. Our first-line weapon is intravenous TPA. It's a powerful thrombolytic, a clotbuster. But, with great power comes great responsibility. We have to follow the rules of engagement with the rigor of a bomb disposal expert. This table lays out the strict indications and contraindications. We check every single box to make sure our intervention helps, not harms. Now for the big jobs, those large vessel occlusions blocking the brain's major highways, we call in the specialists. Endovascular thrombectomy, it's nothing short of a heist in reverse. A catheter is snaked up through the arteries and the clot is literally pulled out. It is a direct mechanical solution, and for the right patient, it is absolutely spectacularly effective. So the immediate threat is neutralized. Blood flow is restored. Fantastic. But a good detective's work is never done. We haven't solved the case until we understand the motive. We have to unmask the true culprit behind this attack. Why did this happen? So let's take a look at the rogues gallery. We've got our usual suspects, right? Atherosclerosis, hardening the arteries, a clot thrown from a fibrillating heart. But we also have to consider the unusual suspects. Things like arterial dissections, hypercoagulable states, vasculitis. Identifying the true mastermind from this lineup is the only way we can prevent a repeat offense. And this brings us to our final, and you could argue, most crucial act. We have to implement a security plan to make sure this criminal organization of risk factors never gets the chance to plot another attack. This is the art of secondary prevention. To foil future plots, we have to dismantle this entire criminal underworld of risk factors. I mean, look at this evidence. The relative risk linked to hypertension and diabetes is enormous. These aren't just medical conditions, they are accomplices in the crime. Controlling them is absolutely non-negotiable in our quest for justice. Just take a moment to let these numbers sink in, because this is the battlefield where we'll fight to protect our patient's future. And here it is, our prevention toolkit. We've got antiplatelets to make those platelets less sticky, anticoagulants for high-risk heart sources, high-intensity statins to stabilize plaque, and aggressive blood pressure control. Each of these, plus major lifestyle changes, is a critical tool to keep our patients safe and foil any future plots. So, there you have it.
You've solved the acute case, a brilliant piece of detective work. But as you close this case file, I want you to remember, your watch has just begun. That criminal underworld of risk factors is always lurking. Vigilance is the absolute key to lasting justice for the brain. The investigation continues.